is an interesting topic. I mean, in our elderly lives, I'll put it like that, so our millennial lives, we often hear of if maybe someone is having a bad mood, it's like, oh, it's the hormone. Anything that's not so nice is associated with hormones. And even teenagers growing up, and starting developing, I guess, attitudes, people label it and say, no, this one is going through their hormones. So I just wanted to ask, in terms of that, we often hear it coming from elderly people, hormone this, hormone that. How soon should people, especially women, how soon should they start educating themselves and also going to hormone specialists for consultation? How soon should they start doing that?
So immediately their period starts.
So as soon as they hit puberty?
Like, yes, maybe from the age of 12, 14. Yes, so that because knowledge prevents confusion.
Exactly.
I mean, they should know what is normal and what is abnormal. That will equip them like from puberty throughout like their life. So immediately, like they start their first period, they should be like well informed about on what is normal and what is abnormal. Yeah.
So the sooner the better, essentially.
Yeah, the sooner the better.
But also talking about teenagers, a lot of them tend to suffer from skin issues like acne, and all of like sebaceous glands not behaving. When patients come to you and they have those skin problems, especially teenagers, what do you normally recommend that they do?
So firstly, since I said I don't just jump like into like a diagnosis, like we first need to gather like all that data and then formulate hypothesis. So usually like acne that is caused by hormonal imbalances. So it's on your jawline and chin. So yes, I agree that in teens, the primary cause or the usual cause is hormonal, but then it's not always like hormonal.
Yes, you still have to
so
do a hypothesis.
yes, and before like taking a pill, because that's what you get when you go to a GP. So you have to first look at their blood sugar levels. You need to look at their cycle patterns.
Yeah.
You need to look at gut health, stress levels, and then see like which aspect of their lifestyle is causing is the main factor, like is the main cause of the hormonal imbalance or the acne, and then you can then like fix that before like putting them like on the pill.
I love what you're saying, that oftentimes parents go to the doctor and then they're like, oh, you have acne, here's a hormone control pill. But actually the functional hormone specialist is not in the room to actually help guide that conversation and also talk about the consequences, because pills also have consequences. And what are some of those consequences that you've seen in some of your patients who took pills to sort of reduce a certain hormone but didn't really understand what consequences they face?
So usually like because like a birth control pill stops your natural cycle, like your body's ability to go on periods. And it doesn't really deal with the symptoms, like the root cause of those symptoms. So it just masks the symptoms. So you still have like irregular period, like obviously when you're on pill, you won't have period, you just spot. You still have like mood swings, like unstable mood. And once you also need to know the consequences or the side effects of the pill. Like for example, when you decide to stop the pill, and you have your PMS, you still have like weight gain, you have difficulties regaining the normal. Yes, so maybe like it will take you 3 to 6 months to regain the hormonal balance, like to go like on period like regularly. And so those, and then when you stop like the pill, Another factor or another issue that I usually see, it's heavy bleeding. Yeah, acne comes up because remember the pill just masks the symptom. So when you stop it, so all those symptoms that you initially took the pills for, they come back.
And they come back hard, hey?
Like hard. And yeah, it can affect your fertility should want to come out of pill and get pregnant. So maybe you have to wait like for 6 to 12 months to regain that balance.